Obsessive-compulsive disorder by Sheila Samandi
and Iya Fochibi.
Obsessive-compulsive disorder. OCD is characterized by repetitive, unwanted, intrusive thoughts and irrational, excessive urges to do certain actions. Although people with OCD may know that their thoughts and behaviors do not make sense, they are unable to stop them. The exact cause of obsessive-compulsive disorders is unknown. There is evidence that OCD has a genetic component and is believed that activity in several portions of the brain is responsible due to an abnormal response to serotonin.
I understand you're under a lot of pressure, but it's going to do me no good if you crack up on me like that. All right? Look, take a couple hours off, all right? You relax a little bit.
Okay.
See your wife.
Okay.
Should have shown me all the blueprints.
All right.
Blueprints. Yeah, blueprints. I'm serious now. Show me all the blueprints. 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 I want to get this done right, so show me all the blueprints. 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 Show me all the blueprints.
Symptoms typically begin during childhood, the teenage years, or young adulthood, although males often develop them at a younger age than females.
Obsessions are defined as intrusive, irrational thoughts, impulses, or images that persist and repeatedly occur so that they cannot be dismissed from the mind. People with OCD know these obsessions are irrational. However, they are afraid that somehow they might be true, which leads to severe anxiety. Common obsessions include thoughts about harming or having harmed someone or fear of contamination. Compulsions are ritualistic acts, behaviors that temporarily relieves the anxiety brought on by an obsession. Common compulsions include hand washing due to a fear of germ and checking to see if the door is locked.
Nursing interventions.
Goal 1. To assist in coping with compulsive behaviors. Accept rituals and avoid punishment or criticism. Do not interrupt ritual behaviors because this will increase anxiety. Plan for extra time because of slowness and patience need for perfection. Prevent physical deterioration or harm and set limits only to prevent harmful acts, such as hand washing excessively that it removes the skin from the hand surface. Goal 2. To encourage patients to develop different ways of handling anxiety. Reduce demands on individuals. Convey acceptance of the patients regardless of behavior. Encourage alternative activities.
Nursing interventions continued. Approach the patient unhurriedly. Provide an accepting atmosphere. Don't show shock, amusement, or criticism of the ritualistic behavior. Keep the patient's physical health in mind. For example, compulsive hand-washing may cause skin breakdown, and rituals or preoccupations may cause inadequate food and fluid intake and exhaustion. Provide for basic needs, such as rest, nutrition, and grooming, if the patient becomes involved in ritualistic thoughts and behaviors to the point of self-neglect. Let the patient know you're aware of his behavior. Explore patterns leading to the behavior or recurring problems. Listen attentively, offering feedback. Encourage the use of appropriate defense mechanisms to relieve loneliness and isolation. Engage the patient in activities to create positive accomplishments and raise self-esteem and confidence. Encourage active diversional resources such as whistling or humming a tune to divert attention from the unwanted thoughts and to promote a pleasurable experience. Assist the patient with new ways to solve problems and develop more effective coping skills by setting limits on unacceptable behavior. Gradually shorten the time allowed, helping him to focus on other feelings or problems for the remainder of the time.
Treatment for OCD. Psychotherapy. 2 types of psychotherapies are helpful for treating OCD. 1. Exposure and response therapy expose the person to the cause of their anxiety to ultimately fit their compulsions. 2. Cognitive behavioral therapy focuses on the thoughts that are causing distress and changing the negative thinking and behaviors associated with them. For OCD, the goal of cognitive behavioral therapy is to recognize the negative thoughts and with practice gradually lessen their intensity.
Medication. Selective serotonin reuptake inhibitor antidepressant agents, such as fluoxamine and the tricycline antidepressant, have been proven to be especially effective in people with OCD. A combination of medicine and therapy is superior to either approach alone. While medication may work directly on the brain, the therapies are believed to help retrain the brain to recognize false threats.